Good afternoon, everyone. My name is Emma Kurth, and I am a training specialist and today's host from the Child Care Center Licensing Unit within the Department of Children, Youth, and Families Licensing Division. First, I'd like to thank you all for being here with us today, and also we all wish to thank you for all the hard work that you do throughout the state to support children and families. Our Outreach Connection webinars are one way that we as a licensing team have worked to bring relevant information together from us and from some of our state partners to make sure that you're hearing information and updates directly from us, in addition to the other ways that we communicate information like email and on our website. We work hard to connect, to hear from you, and to partner for ways to support the work that you do for children and families through Minnesota. And so today's presentation is just that, a way to connect and provide what we hope will be valuable and useful information for you. Before we get started, we have just a couple items to go over. First, an accessible handout with links to more information from today's Outreach Connection webinar has been posted to the DCYF Licensed Child Care Center website under News and Updates section. It's inside the toggle that's titled Upcoming Outreach Connection Webinar for Licensed Child Care Centers, December 9th. I'm also going to drop the link to the handout into the chat in just a minute. Second, today's presentation is being recorded and the recording will be posted on our webpage as soon as we are able to get it transcribed. And now for our agenda for this afternoon, we have heard from license holders that there are certain topics that they want to hear more about. And with so much going on in our industry right now, we want to be able to respond to that. So we have invited content experts from several of our partners in state service to share information. And so this is a snapshot of what we will go over today, a legislative session update, a little bit on regulation modernization project, the provider hub, Great Start compensation payment program, and then some general licensing updates. And with that, I will hand it over to my colleague, Karen.
Thanks, Emma. Hello, everyone. I'm Karen Quincy. I'm a policy analyst for the Office of Inspector General at DCYF, and I am going to kick things off by giving a legislative update from this 2025 legislative session. Next slide. So just a reminder, we sent out the legislative implementation plan on August 1st. Hopefully you all have received it in your email. If you want quick, easy access to it, just a reminder, it's always posted on the Child Care Center website under News and Updates, as well as under the Legislative Changes heading. It's also included, a link to it is included in the handout that Emma prepared for this event today. Since we sent out the implementation plan, the Reviser of Statutes website has been updated, so that's a great resource for you all as well. Next slide. So I'm going to go through each of the topics in the implementation plan. The first being staff distribution. So new language was added into 142B.41 subdivision 14 that allows for some staff distribution flexibility during morning arrival and afternoon departure, as long as it doesn't exceed 25% of the center's daily hours of operation. And you can apply this as long as the aide meets some specific requirements, including that they're at least 18 years old, that they've worked in the center for at least 30 days, and that they've completed all of their orientation training and training required within the first 90 days of employment. So if this sounds familiar to you all, it's because it just makes permanent language that was in place for a few years and was set to expire on July 1. So now it is permanently in statute without an expiration. Next slide. Next, there's a change to how long maltreatment orders have to be posted. So if a center receives an order of a conditional license, a license suspension, a temporary immediate suspension, fine, or a revocation, and then one of those things is accompanied by a maltreatment investigation memorandum, then both documents have to be posted in the center for 4 years. Previously, the requirement had been 2 years. So this is effective for anything issued on or after July 1 of this year. Next slide. When it comes to in-service training, there's a small but important change to note. Now, substitutes and unsupervised volunteers have to complete a minimum of 2 hours of training each calendar year. There's no change to the training topics or frequency, so it's not going to radically change anything that you're doing. Really, the important thing here is to now make sure that as you're recording trainings for subs and unsupervised volunteers, that you're including the length of training so you can clearly show that they've met that minimum of 2 hours. And this change was made to meet the federal Child Care and Development Fund requirements that said we needed a specific number of hours listed in statute. And this is already effective. It was effective July 1. Next slide. Next, the definition of education has been expanded as it relates to staff qualifications to include a lot more additional coursework. The old definition that was in Rule 3 has been repealed, so it's no longer in effect, and now the definition lives in 142B01 subdivision 12A. And this change was effective August 1st, and the form or the resource document for accepted college courses to qualify classroom staff has since been updated since we sent out the implementation plan, and that is also linked in the handout that Emma has prepared for today. Next slide. Next is about correction orders posted on Licensing Information Lookup, or LIL. So pending federal approval, correction order violation information cannot be posted until either the 20-day reconsideration request timeline has passed, or if reconsideration has been requested, until the commissioner's final disposition has been provided. So there's no change to what providers need to do. This will just be implemented on the agency side of things. We are in conversation with the feds about how to implement this language. It will not be implemented January 1st. Conversations got delayed due to the extended government shutdown this fall, but we are working on it and will implement it as soon as we are able, working with our federal partners. Next slide. With the child passenger restraint systems training, there's a change to the age in which it's required. So now, starting January 1, 2026, child passenger restraint systems training is required before transporting a child or children under age 9 in a motor vehicle. The previous requirement was under age 8, so it's just bumping it up a year. And this change was made to align with changes that were made in 2024 to the Minnesota Transportation Law in section 169.685. So it just provides some consistency in ages across those requirements. Next slide. Next, there was direction given to the department and the commissioner to develop standards for licensing visits. So that includes the steps of a licensing visit, expectations for licensors and license holders, standards of conduct, rights of license holders, when and how to request technical assistance, and a process for license holders to request additional review of an issue from someone other than their assigned licensor. So this has to be developed by July 1st of next year. And I believe my colleague Donna will be talking more about this, this item later in today's presentation. Next slide. Another item with July 1st effective date is interpretive guidance. So this new language says that license holders may request interpretive guidance from the department on a rule or statute prior to requesting reconsideration of a correction order. So as we get closer to this effective date, we'll be able to share more about this process. Next slide. Another July 1st effective date is the video security camera language. Beginning July 1, 2026, licensed child care centers that are issued a maltreatment finding that's accompanied by an order of conditional license, order of license suspension, a temporary immediate suspension, fine, or revocation are required to have a video security camera in each room designated for infants and toddlers. Centers will have up to 6 months to comply from when the maltreatment memo is posted, and then must remain in compliance for 4 years, or that entire duration that the maltreatment memo has to be posted. The statute has specific language about the camera and record retention requirements, so I encourage all of you guys to review that language in 142B.68. I'll also call attention to the fact we know that there have been a lot of questions about this language and some misunderstandings about how broadly it applies. So we did send out a clarifying email in October. I believe it was October 20th, with some more information to just try and clarify who this applies to and what the requirements are. So you can refer back to that. That is also linked to in the handout for today's presentation. Next slide. Last item for this session is another update about LIL, the Licensing Information Lookup. The legislature provided funding to support some IT changes to LIL to come into compliance with the updated Federal Child Care and Development Fund rule, the CCDF rule. The updated rule requires that all items that are reviewed at a visit be displayed. So that includes areas of compliance and areas of non-compliance. Related to that, changes were made to the documented technical assistance language in section 142B 171, subdivision 2, removing the language that documented technical assistance will not be publicly posted. Next slide. Next, I just want to touch briefly on some potential ideas for the 2026 legislative session. Next slide. And to just keep in mind, the policy and budget proposals are still being developed and vetted. So what we're talking about today are just ideas and not final proposals. And I'll share a little bit, and then my colleague Brandon will talk about the modernization project. So the main piece I wanted to share today, potential idea, relates to that interpretive guidance that I mentioned earlier that passed in the 2025 session. So we're looking to potentially do a little bit of clarification with that. One is to align the effective date, so it would match with the revised licensing standards, which we're looking at proposing an effective date of July 1, 2027. So the intention here is that we're not kind of having to quickly duplicate work, that we create interpretive guidance once with the revised standards and not do it this year and then again a year later. And then we're also looking at potentially clarifying the applicability. The language isn't specific. It's our understanding that the legislature, their intent it was for it to apply to family child care and licensed child care centers and only those two license types, but the language isn't specific. So we're just looking to clarify that language. And that is all I have. So I will pass it off to Brandon next. Thanks, everyone.
Thanks, Karen. Hey, everyone. This is Brandon here, just getting my camera and everything all set up. But thanks for joining this afternoon. And I am going to talk about the Child Care Regulation Modernization Project and some updates there. Next slide. All right. So first off, just wanted to say thank you to everyone on this call. Hopefully you've had a chance to be part of the engagement over this whole the duration of the project. Just wanted to recap a little bit of where we've been before I share where we're going with the revised licensing standards in particular for the project, and also just an overall report on the project that we're expecting to be out there in January. So uh, really October 2022 is when the revised licensing standards, when we first began the engagement work on that, having a survey to get input on what the field saw as areas of the regulations needing to be updated or changed. Definitely staff qualifications and equipment were the top two that stood out there, but there was also other things that we learned from that survey and that effort, which got a lot of response. All of this on the handout that has been shared links to our project website, and you can go to our project website to see reports kind of about more of these engagement efforts that were done if you're curious. Um, but then looking at March 2023, we worked with NARA, the National Association for Regulatory Administration, and they, looking at other states, delivered an initial draft to us, and then we worked with other state agencies, with licensors, and with subject matter experts to do some of the refinement and tweaking work to really get that ready for to be right for sharing publicly. And then April 2024 is when we had that public release. A lot of engagement there. That was, almost 2,500 pieces of feedback from 23 different listening sessions, much of which we did with partners across the state. And then finally, February 2025 is when we had that second draft come out, and more engagement. And so really the point here is that it's been an iterative process, and I've certainly learned as we've gone. We've all kind of learn what needed to be improved, refined, and so right now where we're at is we wrapped up that engagement at the in summer, and then now we are getting ready to release the proposed standards inside of the legislative report. So that's about what's coming next. So next slide. Okay, so in terms of what's coming next, we have a legislative report. This is a report that was mandated when the project was first authorized, and it is due January 1st, 2026. So that is New Year's Day. It's a holiday, so uh, most likely is that shortly after that date, the report will be released and publicly available. So look for it early January, that first week of January. It will include a status update on the weighted risk system and abbreviated inspections components of the modernization project. So this is the weighted risk system being where all licensing regulations are assigned a weight on a scale of 1 to 10, and then you can kind of categorize different licensing regulations by low risk, medium risk, high risk, and then abbreviated inspections being where eligible providers have shortened inspections if they meet certain criteria. So the report will include a summary of work done to those on that date and next steps for implementation. And then the report's also going to have the revised licensing standards. It will have the proposed licensing standards based on the feedback we've gotten throughout the duration of the project. And then we're also going to include in there a comparison between the existing licensing standards, so what's in Rule 3, what's in 142B, as well and then the proposed standards. I also want to note now that we all of the changes that Karen went over in terms of the 2025 session, those will be reflected in the proposal. So that's been our approach. It passed in the last session, so we've made sure that those are updated and incorporated into this proposal. Um, so yes, I think that's all I have to share there. Next slide. All right. So really, we're going through all of the internal review and everything that's needed to get that report ready to be shared out. So just a short update for now, but I promise there will be plenty more coming in the new year. The links on this slide are available in that handout, and essentially you can look at our project website, which we expect very soon to have a new DCYF project website. We're still kind of on the DHS branding and whatnot, but you can find links to more resources on our website. You can also sign up for our email list on that site, That's really where we're gonna, make sure we send out the announcement when the proposal is posted, or the legislative report is posted, and then any updates on sort of where it goes from there, in the upcoming legislative session. And then you can also, of course, reach out to us at the shared inbox there. So that is, yeah, that is it for us right now. Thanks, everyone. I think I'm going to pass it to Katie.
Hi, folks. Katie Lane here, representing the Provider Hub. My role on the team is as an instructional designer. I work with some fantastic colleagues to create the instructions and the learning materials you all need to successfully navigate the tool. Go ahead to the next slide, please. So giving us a grounding in what the Provider Hub is, who's using it. So the Provider Hub is a place where folks can apply for social services licenses, funding and programs, manage that license or certificate. You can log into the Provider Hub anytime from any device, and it's accessible in 4 languages: English, Hmong, Somali, and Spanish. Currently, all of you folks are using it, licensed and certified childcare centers, as well as family childcare providers who are using the Child Care Assistance Program, CCAP. We also have legal non-licensed childcare providers and childcare providers licensed by a tribal nation for CCAP. You can go ahead to the next slide, please. Today, I wanted to show you all some resources we've put together in one place where you can easily access learning materials, instructions for navigating the Provider Hub. We've developed what we're calling learning libraries. These are collections of Provider Hub help articles, guides, interactive learning that you can use to navigate the Provider Hub. Next slide, please. These learning libraries are for anyone who's going to be using the Provider Hub. So all of you who are currently using it, new providers who are wanting to become a licensed center, and anyone who is preparing to use the Provider Hub in the future. We have resources for all these groups. Next slide, please. We realize that you want to go to one place to get the learning, to get the instructions you need, and be able to use them anytime. These learning libraries are posted on the Provider Hub webpage, and they are publicly available, so you don't need to be logged into the Provider Hub to use them. And we hope that by using them, you can gain confidence in the tool and also use them as a resource in case you get stuck as you're using them. Next slide, please. So all these learning libraries are located on the Provider Hub webpage under the resources section. And actually, I'm going to borrow the screen for a moment to share with you how to get there. So can I get a thumbs up from some presenters if you can see my screen?
All good.
Fantastic, thank you. So I'm going to go to mn.gov/dhs/provider-hub. This is our web page where you can log into the Provider Hub, get some updates on it, and if you scroll down to the resources section, you'll find a number of buckets of learning resources for you based on who you are or what you're trying to do in the Provider Hub. We have a basics collection if you're just getting started, and also collections specifically for licensing and certification. So I'm going to select the Licensed Childcare Centers link to get to that learning library. In this section, you'll find lots of topics related to what you need to do in the Provider Hub. Let's say you are looking to make a change request. I'll select the change request link, and that will send me down the page to all of our articles on change requests, including some basics articles around change requests, how to change information about your program, how to change information about people who run the program. And you can go into any one of these to get more information. It opens up in a new window so you can easily navigate back to where you were. I'm going to toss it back to Emma. I'm going to keep talking, but I am going to stop sharing my screen and you can pull up the slide deck again. Thank you. And you can go ahead to the next slide. Some other things on our webpage that I wanted to highlight. This is the place where you can get all kinds of information about the Provider Hub and what's happening. That includes release notes. Release notes are updates, changes to the tool itself. So say we might have made some color changes to the tool to make it more accessible, or made some changes to some of the text in the Provider Hub. Those you would find in release notes. Then those are sent mid-December, those release notes, to authorized agents and delegated authority access users. We also send out a newsletter about every 2 months. You have to subscribe to that newsletter to get it. Next one is coming out mid-December. And we also host public information sessions. Registration is required for those. We host those about every 2 months. And the next one is coming up in January. And you can see those and sign up for those things at that website too. You can go to the next slide, please. Other ways to get support and feedback. Again, this tool, we are changing it and improving it all the time for you. This is not a thing that is one and done. We have more resources for you. You can search for those articles that I displayed for you directly inside the Provider Hub tool. If you need support beyond those help articles, we have a fantastic local support team, our product success team. You can give them a call. If they are not able to answer the phone, do leave a voicemail for them so they can get back to you and respond to your concern. They are such fantastic folks. And if you have feedback on the tool itself, not necessarily needing help in it, but want to give us feedback on how we can improve it, that email address listed, providerhub@state.mn.us, is an excellent place where you can let us know what you want to see improved, changes, and we will get it to the people who need to see that. And I think I saw a comment in the chat. Marnie, thanks for your comment. Great if those libraries were linked inside the resource tab within the hub itself. Thank you for that feedback. I'm actually going to a meeting about the help and resources section tomorrow, and I can bring that feedback. Thank you so much. That's what I have. Thanks for your time and attention. I'm going to pass it to my colleague, Dana, about the Great Start Compensation Program.
Thanks, Katie. Hopefully you can hear me. Maybe a thumbs up from Katie or someone else just letting me know you can hear me so I don't keep talking.
I can hear you,
Dana.
Dana.
Great, thank you. I've had that in the past. I just kept talking away. Here we go. So Great Start Compensation Program updates, and I just have 3 slides for you today. I'm going to jump into the first slide as a reminder of what the Great Start Compensation Program is, just in case you aren't or aware of the program itself or the benefits. So the Great Start Compensation Support Payment Program is a nation-leading effort designed to strengthen Minnesota's childcare workforce or by increasing compensation and benefits for those that are caring directly for children. So eligible providers, such as yourselves here, currently apply each month to receive Great Start compensation payments and ensuring that the funds continue to support staff on an ongoing basis. On the right-hand side of the slide, just a few pieces of information about what's happening in the Provider Hub currently with Great Start, which is that youth centers and certified programs by the state can complete monthly applications there within the Hub. There's the use of funds report that is now available in the Provider Hub to complete as it's due, and all that's listed for due dates inside the Provider Hub. And providers can update their supplier ID information in the Hub to manage payment preferences like direct deposit. And on the left-hand side, just that information about what that program is. So as we move into the next slides here, if you are new or continuing, you'll want to know some of the policy updates that you might have already seen in the October 2025 GovDelivery newsletter. So on the right-hand side, I just have a few QR codes for you. The top one is a link to that newsletter that you should have received. And you could use a QR code, or the handout also has the link to that. So this information I'm giving you, this won't be the first time or the only place to get it. So a few of the policy updates include like payroll taxes, reminding providers that federal payroll taxes are allowed. State payroll taxes were technically not allowed, but we know that the communication was not clear. And so starting as January 1, state payroll tax increases due to Great Start compensation increases will not be allowed. So just federal payroll taxes, the increase on the taxes that you incurred because of the increases to compensation just for federal taxes. Expense backstop date is one of the other information here that we give you in the newsletter as well. It's been clarified. So funds can only be used for expenses that occurred on or after your designated backstop date. So it's important to keep those timelines in mind, and the newsletter and our webpage gives more information about that. And I'll give you a resource to call if you also have more questions after today's conversations. And the baseline compensation concept has been removed. Programs now just need to show that the pay has been raised beyond what you would have incurred without this funding. So how did you pay for an increase to compensation? As a reminder, programs should report actual hours worked directly with children. There's no need to calculate full-time equivalent hours for staff. We know that there's a frequently asked question about this, and the calculations are on the webpage, but we want people just to be entering the actual hours that staff worked directly with children, and it calculates it for you. So no need to be calculating and trying to get those calculations clear, just entering exact numbers of hours worked directly with children. And then make sure that you keep clear records of showing how the funds support compensation increases. On the next slide, we have a reminder of where you can get support for the things I've talked about today or other questions. In general, the Great Start compensation team has a phone line here and also language assistance available, Spanish, Somali, Hmong. So make sure to give us a call if you have questions. But we also have the same feature that Katie was talking about, where you can search for knowledge articles in the Provider Hub about the Great Start payment program, about the use of funds requirement, supplier ID information I mentioned. All of that is searchable in a knowledge article, and we have the learning libraries for each of those topics. We can also create a support ticket in the Provider Hub to reach us, and also view Great Start compensation, our webpage, and frequently asked questions on that QR code or in the handout that I had in the last screen. So thank you so much for the time just to remind you about the program, and also that there is communications out to you or available to you about policy updates, and we're always available, just a phone call or email away. I'm going to pass it to Donna now.
See me?
And
Okay, good. Hello, everybody. My name is Donna Gaynor. I am one of the supervisors in the child care licensing division. And I just wanted to say, if you have a question during my part of the presentation, if you could just make sure it goes to all the panelists. I have some of my colleagues here who will be answering those questions for me while I talk. So we will go ahead and get started. Next slide. So the Minnesota Department of Children's, Youth, and Families Office of Inspector General houses our licensing division. The Child Care Center unit directly licenses child care centers throughout the state, while local counties or agencies are delegated by the Family Child Care Unit to oversee licensing duties for family child care licenses in order to ensure they meet minimum standards for health, safety, and care and physical environments. Next slide, please. So the licensing division of DCYF has a critical role in monitoring and supporting health and safety in approximately 10,600 licensed child care programs in Minnesota. Licensing childcare helps protect the health and safety of children by requiring that providers meet minimum standards of care and physical environment. These requirements ensure childcare programs offer healthy and safe environments for children to grow and learn. Licensed childcare providers and their staff, caregivers must meet minimum qualifications and receive ongoing training to provide appropriate care. Licensed childcare providers, licensed childcare programs must ensure that children are safely supervised, kept from harm, and given the attention they need. Childcare licensing also requires programs to support children's development and learning. Requirements include the following: childcare supervision, criminal background checks for childcare staff, ongoing training for child care staff, such as CPR, first aid, and safe sleep for infants, sanitation, emergency planning, building safety, child and caregiver health, and ongoing monitoring to ensure that child care programs continue to meet all health and safety requirements. And so that is our role here at DCYF Licensing. Next slide. Minnesota requirements for licensed child care centers. Compliance to applicable requirements in rule and statute is required for DCYF child care centers to remain in good standing. The applicable requirements for licensed child care in Minnesota are in the Minnesota statute, chapters 142B, that's the Human Services Licensing Act, 245C, which is the Human Services Background Studies Act, and 260E, which is the Maltreatment of Minors Act. And then specific rules for licensed child care centers come from Minnesota Rules, chapters 9503. And then for licensed family child care, they come from Minnesota Rules 9502. The Office of the Revisers of Statute website offers a searchable site to Minnesota statutes, session laws, and rules. And the website is right there on the screen. And I believe you guys are all going to get a copy of this presentation, so you will have that. So I don't need to read that. When licensing moved to DCYF in the summer of 2025, Statute 245A turned into Statute 142B. In order to access the current requirements easily, we recommend that you visit our licensed child care center's website, news and update section, to access a licensing statute crosswalk. The crosswalk outlines where the requirements are currently found and where they will be found in the new chapter of the statute. You can also find them throughout the reviser's website just by searching 142B, and then it'll have all the different sections right underneath that. Next slide, please. In 2019, the Child Care Licensing Unit was allotted additional funds that allowed us to provide extra support to programs during their first year of licensure. You may have heard this called early and often. Statistics show that success during the first year of business can prove to be critical to the sustainability of the businesses to survive long term. Licensing requirements, in addition to business needs, can be difficult. There are many things to keep track of. We understand the complexity of this, and we have worked to find ways to help businesses get off the ground with greater understanding, hoping they will find great success. So what does this look like? So in the first year, you'll receive quarterly visits. Your first early and often visit after your pre-licensing visit will be approximately 3 months from opening and will be scheduled with your licensor. There are no citations for this first visit. It's only technical assistance. Subsequent visits are unannounced. Each visit is a piece of the checklist, with the final visit being a full review, the whole checklist. That's conducted after the program has been operating for 1 year. These visits allow us to offer extra support and resources to new license holders and help build that extra connection with DCYF. The goals of these early and often visits are to make sure improve success for newly licensed child care centers to improve sustainability, a better understanding of DCYF licensing regulations and compliance to other agencies that partner with licensed child care centers. And finally, improve health and safety for the children in the licensed child care programs. Next slide. Unannounced annual inspections. So prior to your yearly visits, you will be notified via the provider hub that your licensor is requesting updating staffing paperwork. You will follow the instructions in the document, ensuring all information requested is available in the provider hub. This will alert you that your yearly inspection will be coming up in the next few months. Although it will not be scheduled and you will not know the exact date that it'll occur. If there are days over the next few months that your program will be closed or that may not be ideal days for a licensing visit, please alert your licensor. Though we can't guarantee that we will not come out on those days, not so ideal days, we will try to avoid them as best as our schedule allows. Once your yearly inspection is complete, you can expect an exit interview with your licensor. During this exit interview, your licensor will go through the visit with you and discuss any licensing violation found on site, if any. This exit interview may be conducted in person or scheduled over the phone after your visit, depending on your availability and your licensor. Your licensor cannot issue a correction order or licensing action until it is discussed during the exit interview. Next slide, please. So an annual inspection, a full or modified review. So there's different kinds of inspections that can happen. Reviews are unannounced annual inspections once per calendar year. So it doesn't necessarily happen the same month every year, just sometime the next year. A modified, that's the most common type of review that most centers will have on their annual visit. A full review occurs at the end of your first year after you've been open for 1 year, or if the program has had a maltreatment determined against the facility since your last licensing review. So again, most people get modified reviews. You get that full review after you've been open a year. Next slide, please. What to expect during your annual visit. Your licensor will tour your facility and observe your program in operation. This includes observations of each classroom, interactions between staff and children, the level of supervision of children provided by staff. They may look at diaper changing procedures, hand washing procedures for children and staff. They may observe meals and snacks that are being served. Your licensor will also spend time in your program inspecting areas of the building used by the licensed program, including outdoor play areas and indoor. The licensor will look for potential hazards to children. Adequate amount of age-appropriate equipment and furnishings are available. The condition of the equipment and furnishing, visibility of documents required to be posted in your facility. They'll look at cleanliness, storage of medications, etc. All of those things, again, can be found in the statute and rule. They will also review some of the administrative records. The licensor will review relevant documents you are required to maintain, such as crib inspection forms, documentation of incident, accident, and injuries, medication administration records, health consultant documentation, fire and tornado logs, program policy book to make sure it's on site and available to staff. They may look at behavior guidance, separation logs. They'll look at your risk reduction plan, your emergency preparedness plans. They also look at things like your personnel files. Your licensor will look for documentation required to be kept in each staff file, such as identifying information like name, address, phone number, date of birth. They'll look at training records, that there's a completed personnel information form and copies of documentation needed to qualify staff for their positions, such as post-secondary transcript or like a Child Development Association credential. Keeping files up to date and organized over time will help ensure reader documentation is completed and easily found during the inspections. Licensors will also review children's files. Your licensor will review a sampling of children's records and look for information required to be kept in the children's files, such as how to reach a parent or guardian in an emergency situation, who the emergency contacts are, people authorized to pick up your child from the center, documentation of special needs, including allergies, and plans to make sure the child's individual needs are met while your child is in their care. They'll look at healthcare information, they'll look at immunization records, and there are specific requirements for infants and toddlers that they also look at. And exit interviews are required as part of the annual licensing inspections. Licensors cannot issue a correction order or other licensing action for violations of the rule or statute that are not discussed during an exit interview, unless the provider does not participate or complete the exit interview. Licensors must offer an alternative time to complete the exit interview if it cannot be completed at the conclusion of the annual licensing review inspection. The exit interview is an opportunity for you to discuss the licensing review inspections with your licensor. The goal is to have open communication and transparency about licensing requirements in order to assist you in achieving ongoing compliance. If you do not participate in an alternative date or return the phone call or email of your licensor, the correction order or other licensing action will be completed without additional discussion. Next slide. There are different types of licensing actions that can be issued. If licensing issues become chronic, numerous, and or more serious, a conditional license could be assigned to the program, or they could receive a temporary immediate suspension, or a revocation could occur to the license as well. There are certain licensing actions, such as safe sleep, background studies, maltreatment violations, that could result in a fine. More details on the various types of licensing actions can be found on the child care licensing webpage. If the applicant or license holder believes that the contents of the commissioner's correction order are in error, the applicant or license holder may ask the Department of Children, Youth, and Families to reconsider parts of the correction order that are alleged to be in error. Information on how to request reconsideration is included in the correction order that is sent to the program's authorized agent via the agency hub. Next slide, please. License holders may request reconsideration of licensing actions, including citations, by notifying the commissioner through the licensing hub within 20 calendar days after the license holder received the order. License holders may also request a contested case hearings on fines, suspensions, and revocation in the hub within the first 10 days after the license holder received the order. And my last slide. So coming soon, the standard licensing visit. Karen briefly mentioned that next year we are required to develop a document that is going to include the steps of the licensing visit, expectation for licensors and license holders before, during, and after a licensing visit, the standards of conduct that licensors must follow during a visit, the rights that license holders have, when and how license holders can request technical assistance, and finally, the process for license holders to request additional review of an issue related to a licensing visit from someone other than their assigned licensor. We are in the beginning stages of creating that document. It is in draft now. That should be done soon, and we will have stakeholder engagements once that's done, and we'll get your guys' input on what you would like to see in it, see what we have prepared for you, and then we will present it in July and see where it goes from there. So that's all I have. I think I'm passing it off to Emma.
Thanks, Donna. We are going to jump into the last part of our presentation here, which is an overview of the top 5 cited areas from 2025. We have pulled this from our electronic checklist data. And while I'm presenting, if you have questions, go ahead and message them to Jay Condon. Jason is how it should show up, or maybe Jay, I don't remember what we put in there. He is one of our licensing supervisors. He'll be able to take your questions. So many of you may be able to guess or assume what some of these will be based on your own experiences or those that you are connected to in the field. So I'm going to go ahead and review each area, the requirements themselves, and share some concrete examples of what recent noncompliance has looked like in the field over the year, as well as ways to best set up yourself to maintain compliance. The first area we're going to get into, the top non-compliant requirements in 2025, is training. We have bucketed several of these items, these training items together. Training requirements have many different components, and we'll discuss these top 3 main items. Most common were not meeting requirements for completing orientation for new staff, not meeting the requirements for yearly in-service, and for first aid and for CPR. So on the next few slides, we're going to get a little deeper on each of these areas and talk about the requirement, what people have been missing, and how to best maintain compliance. A key compliance tip for training is your documentation. The importance of documenting things like orientation dates and training hours is critical. And the best way to ensure that you're covering all required topics is to use our forms. And you can see images of the orientation form and the yearly in-service training record here on the slide. This isn't a requirement, but we do strongly suggest it. Each form walks you through every required item, where to find it in rule and statute. It asks you for the training date, who ran the training, if applicable, how long it was. And this ensures that you and your licensor have easy access to the documentation needed to show that you're in compliance. Before I was a training specialist, I was a licensor, and I have many memories of digging through deep files, hoping to find the right documentation to not have to cite a program. So your documentation and your organization is key in being able to show that you've done the trainings that you need to have. Again, not a requirement to use the form, but as you'll see over the next couple of slides, there are a lot of topics to keep track of. And so this is one of the best ways to set yourself up for success. Links to both of these forms are in your handout, and you can also find them on our website under Forms and Other Documents section. So orientation was our top cited item within training. And the requirements for orientation are that the Child Care Center license holder must ensure that the director, staff persons, substitutes, and unsupervised volunteers are given orientation training and successfully complete the training before starting assigned duties. And assigned duties are anything having to do with kids being in the classroom. The orientation training must include information about the topics here on the slide. It's quite a bit of text. We'll leave it to you to read through it. And what we cite for most often here is that there are specific items that get missed in orientation. So making sure that you are hitting all of those required topics and have a good way to track and document what's been completed, whether that's on our form or a different method that you may use. Another commonly cited area within orientation is that it must be done before contact with children. And this is another area where your documentation skills can be critical. If you have a staff person start, but their first few days are spent with you training in the office and not having contact with children, you must make sure to document this with an accurate first date of contact. And that is the green arrow that you see here in the right image. So in that scenario, the date of first contact would be different than the hire date to show that they were doing training over the first few days and not in the classroom. Documentation is so imperative on many items, and this is a great area of importance. If any orientation training dates are listed after that date of first contact, you would be cited for staff not having completed orientation before having contact with children. We cite for that quite often. We must see documentation to prove that programs are meeting the orientation requirements. And this is why the difference between those two dates is so important. And we have to go by what we see documented on your forms. For first aid and for CPR, staff have 90 days from their date of hire to complete those trainings. However, staff can't work alone with children before having that training. And so until the training is completed, they must always be supervised by a staff person who has completed the training. We often cite for this, and the director or supervisor didn't realize it, only remembering the 90 days part, not the supervision part. If the 90 days passes and the training has not been done, the staff person cannot work in the classroom any longer until completing that training. Another very commonly cited training item is incomplete in-service training from the previous year. And just like with orientation, a license holder must ensure that the center director, staff persons, substitutes, and unsupervised volunteers complete in-service training each calendar year. And as Karen mentioned at the beginning of the webinar, substitutes and volunteers need to complete at least a minimum of 2 hours of in-service. This is a new statutory requirement. The training must meet the requirements you see here on this slide. And for training hours, the number of in-service training hours may be prorated for center directors and staff persons not employed for an entire year. Anything covered by orientation training cannot be used towards yearly in-service hours. This is another item that's cited commonly. If training is taken during orientation, it cannot count towards yearly in-service for that year. So moving into our second most commonly cited topic, hazards. I see a couple questions coming in, and if you can message Jay Condon or another panelist, they'll be able to get you an answer back quicker than I will be. The definition for hazardous objects defined in rule as sharp objects, medicines, plastic bags, and poisonous plants and chemicals, including household supplies, must be stored out of reach of children. So some of the most common items that we've cited for this year under hazards are hand sanitizer or other items that clearly state keep out of reach of children. And this can include even things like diaper wipes. So it's really important to read your labels and know what those labels are saying about access for children. And things like medicines being accessible, and keeping in mind that things like sunscreen and bug spray also fall under that medicines category. Items on teacher desks or counters being accessible. So we have cited recently for things like teacher scissors being out and accessible, cough drops, vitamins, and staff purses and backpacks being reachable by children. We have also seen hot water accessible lately. This shows up most often like unsecured crock pots in an infant room used for bottle warming, or hot coffee on a counter that has the potential to be spillable. Tangled cords. This most recently has looked like vacuums left out in the room, which is being used by children with an unwound or loose trippable cord. Fans. These are often cited as a hazard based on the ability for a child to stick their finger through the grates to the blades when accessible, or hair being sucked into the fan as it's running. Climbers with no padded fall zone underneath, keeping in mind that just carpet or just grass are not adequate fall zones and would be cited under a hazard. Plastic bags on low shelves or otherwise accessible, and unlocked cabinets with cleaners or other such products accessible to children. Some of our key compliance tips for situations like this involve your classroom planning, making it routine, just part of your natural kind of daily flow of your classroom, your daily life in the room, where these objects go and where they get stored, and then teaching that and training in your staff consistently. Building robust policies and procedures, and ensuring that, like I said, you're regularly training in and reviewing on these things. It takes a lot of forethought to make the best plan you can to keep things up and out of the way. It takes regular practice, but taking that time to make a robust routine is your best way to maintain compliance. So making a plan. Where will you store teacher materials? How will you ensure that it's not accessible? Do you have a designated closet or a storage room or a locked drawer? Where will you keep cleaning items to ensure that those are locked away, yet a place that a teacher can reach them? Similar for plastic bags and fans and vacuums, that's available to you as you need it. Those are things that you want to have access to in your classroom, but they're not going to be accessible to kids. And then checking your items, knowing your labels, your hand sanitizers, your diaper wipes, which one of them say keep out of reach, and then what is your plan for storage? And as we've mentioned before, training your staff on where those things need to be, asking for their input on where does it make sense to keep items that strikes that right balance of accessible for staff, but not for children. And it's important to try to strike that right balance of conveniently placed, but not accessible. And we know when it's too out of the way and too inconvenient, that's how things get left out. And then you want to be reviewing often with your staff, making it a routine and running that routine just the routine thing to do, just part of your day. Staff knows where it goes. They know what you expect. It's part of the daily flow. Moving into our next topic, supervision. So the definition of supervision for licensed child care centers, supervision means when a program staff person is accountable for the child's care, can intervene to protect the health and safety of the child, and is within sight and hearing of the child at all times. Now, there are exceptions to the sight and hearing clause. The first one of which is when an infant is placed in a crib room to sleep. Supervision occurs when a program staff person is within sight or hearing of the infant. And when that is the case, the center must have a plan to address the other supervision component. When a single school age child uses the restroom within the licensed space, supervision occurs when a program staff person has knowledge of the child's activity and location and can check on that child at least every 5 minutes. When a school-age child uses the restroom outside of the licensed space, like on a field trip, supervision occurs when staff accompany children to the restroom. The third exception would be when a school-age child leaves the classroom but remains within the licensed space to bring something or get something from their personal storage space. Supervision occurs in this case when a program staff person has knowledge of the child's activity and location and can check on that child at least every 5 minutes. And the fourth exception is when a single preschooler uses an individual private restroom within the classroom with the door closed. Supervision occurs when a program staff person has knowledge of the child's activity and location, can hear the child, and checks on the child at least every 5 minutes. So now we'll talk about some recent examples of supervision citations. In the first one, this is a child in a private in-classroom bathroom, but the teacher had no idea that the child was in there. And this would be considered non-compliant with the requirement that when the child is using the bathroom on their own, the staff person must still know that the child is there and be able to intervene if needed. The second tile is relatively straightforward. A child left the space without the staff person's knowledge. Similarly, in the third tile, a child was left behind in an area after the class left, which went unnoticed for several minutes. In the fourth tile, school-age children must be escorted from their bus into the program. As soon as they're off that bus, they are the responsibility of the program and they must be adequately supervised. In the fifth tile, a child under school age had been sent down the hallway to the bathroom, and the staff person stood in the doorway of the classroom to watch the child down the hall. In a situation like this, that staff person isn't able to intervene as needed for that child in the bathroom. They can't see or hear the child in this scenario. And in the final tile, this was a one-stall bathroom in a classroom where several children had gone in together. Staff knew that they were there, but there was no staff member with them and the door was closed. As we covered in the tiles on the last slide, many of those situations were in direct noncompliance to that definition of supervision. A child in the bathroom without staff knowledge, more than one child unattended in a private classroom bathroom, situations like that. Many of the other scenarios had to do with policies and procedures not being followed consistently, which leads to a citation for supervision. For example, leaving a child behind once the class has left the area, or a child leaving the classroom without the staff's knowledge. Scenarios like this most often come from a breakdown in following the program's policies and procedures. So our key compliance tips here are to encourage your staff to always consider their ability to intervene. Can they see and hear the children that they're responsible for? Are they able to respond appropriately if needed? And if the answer to those is no, there might be a supervision issue. Make sure that your staff are well trained on your policies and your procedures and your expectations. Be sure that these topics are things that you review during staff days. For example, going over how to position yourself in the classroom to see multiple angles, reviewing your roster or counting off as you leave and enter a space every single time, doing a sweep or a walkthrough of spaces like the gym or the playground as you're getting ready to leave. These are all best practices for ensuring that all children end up where they're supposed to be. And during training or review times, you can even create scenarios together that might be tricky and that might come up, and ask how they might handle them. Problem solving together, tricky situations like this can be helpful ahead of time instead of needing it in real life and feeling unprepared. Our fourth topic is background studies. There is a long list of who needs a background study in statute, and we also have a form titled Who Needs a Background Study that's linked in our handout. Largely, though, a childcare background study subject means an individual who is affiliated with a licensed childcare center. Anyone who will be coming into contact with the children served in the program. So what you see here on the slide are some of the most common reasons that we have cited for recently in regards to background study violations. The first one being no study. So these types of citations come from a program just not having a study done for a person who requires one. This can be a current and existing issue or a past issue if the program ran one after the staff started and had contact with children. This is often caught and fixed later on, either by the program catching it and running a background study late, or by the licensor discovering it while prepping materials. Sometimes we also see this happen when a study has expired and the program hasn't run a new one yet. The next bucket under here is eligibility. And this is what happens most often when a program has run a study, but it hasn't come back as cleared yet. Often it's that fingerprints haven't been completed or they are waiting on out-of-state documents. Some part of the process isn't done yet the staff person has already started and is working in the classroom. And the key compliance tips here for background studies mainly involve thorough documentation and communication. Like we've talked about before, your documentation of dates is critical. You could potentially have a staff person completing their orientation training while you're waiting on their clearance. They're not in the classroom, they're not doing anything with children's records or children's belongings or children. But if this isn't clearly documented by your hire date and your date of first contact, you would risk a citation for a background study violation. It's also important to get your background studies running as soon as possible, knowing that this process can take a while. With your new hires, making sure you're staying in contact with them, that if there's trouble getting fingerprints scheduled or completed, you know this, you are in communication, and you're able to adjust together accordingly. And our final of the top 5 areas is cleanliness. And the definition here for cleanliness is the indoor and outdoor space and equipment of the center must be clean. Clean means free from dirt or other contaminants that can be detected by sight, smell, or touch. And some of our recent items for this topic have to do with tables not being cleaned. Examples of this would be meal tables that are still sticky or visibly grimy, greasy feeling, tables that have not been cleaned yet are being used for other items, other things. Dirty bathrooms. And here we are talking about things like dirty toilet paper piling up on the floor, paper towels piling up on the floor, things that are noticeably, visibly dirty, things like that. We know that sometimes toddler and infant rooms may smell like diaper. This is okay. We know that's a thing that happens. It's when it becomes a more obvious trash issue, cleanliness issue, toilet paper, things like that, that we would begin to cite. A room can be cleanly and still have that kind of diaper smell. Garbage cans, this would be something with a buildup of old crusted food where it's obvious that it didn't come from your lunch 30 minutes ago, that it's more of a maintenance and upkeep issue, that it's just not getting cleaned and the food is crusting and existing there. Similarly for food on the floor, here we would be looking at the timeline and some reasonability. If you had lunch 30 minutes ago, we wouldn't expect that everything would be perfect and cleaned up. It's too close to that meal time to be able to expect that. But if we come and there has been no meal served for hours, or we come first thing in the morning and there's food left from yesterday on the floor, that is where it would become a cleanliness issue. Cribs and cots. For cots, the most common item we cite for is when being stored. Those nap blankets are hanging over the side of cots. They are touching other cots and other blankets, which is considered not a clean and sanitary method to store those personal items. And for cribs, this would be items like throw up or crusted snot or poop left on crib sheets that has been there for a while. Again, we would be looking at timeliness. If a baby just had an accident, we're looking more at timeliness here for cleanliness on those items. And finally, equipment. Equipment, toys that are discolored, not from being out in the sun, but from dirt, grime, buildup, things like that. And our key compliance tips here are, again, your policies and procedures. Again, building a really robust policy around your expectations for cleaning items like toys, tables, equipment, and making those policies part of your routine, part of your daily life, the thing that's just so ingrained in your process that it's the way that it is always done. Wiping down the trash can, the diaper lids, a process for cleaning toys at the end of the day, a process for how post-meal cleaning looks. And again, this goes back to classroom planning. So what's going on after lunch? What are your teachers able to get done after lunch once kids are down? Is that a prime time for being able to sweep and work on things? Kind of thinking about the flow of your day and how cleaning fits in with that. And if you're able for deep cleaning, work out some time maybe during a staff day, leaving part of those training days for the ability to be able to do a classroom deep clean. So in conclusion, we are often asked how programs can prepare for a licensing visit. And the answer to that really is that license programs should always be prepared for a review to occur. And implementing some of these key compliance measures that we've covered today are your best foot forward to maintaining compliance and being always ready. So ways to ensure that your program is always prepared is to have and incorporate just a basic licensing understanding into the daily practice of your routines, your policies, your protocols, and your trainings. So by ensuring all staff have received and understand licensing requirements and policies and protocols of your license program, that starts to build that basic understanding. Everyone knows the why of why they have to do these things. Having practices in place, such as a checklist or a routine that just normalizes these licensing standards as a part of a regular day. For example, talking with your staff about things like supervision and ratios, so they too can understand that reasoning, that expectation, why you are expecting them to do things the way that you do. And then training them well and maintaining that training to understand the why is important to establish a system or regular protocol, such as a checklist that's maintained with each classroom as they transition through the building, modeling how to use things like name to face or counting off any time that they're going to a new area. And then during staff meetings or ongoing trainings, go over various licensing rules with your staff and actively discuss and come up together with ways to ensure that each area of the building understands the expectations and how to achieve them. You can even create scenarios and problem solve them together. Another way to prepare for a visit is to set up and maintain organized records. So we've talked a lot about documentation, and I can tell you that licensing visits go much smoother when the licensor is easily able to go through your files and find that information that they need to look at when the program has organized files and systems. It's also important to stay informed about any changes happening or any updates from the state. So watching for and reading your GovDelivery emails, those will provide crucial information from licensing and any legislative updates that may come, and staying alert to other forms of communication from DCYF, such as our websites, webinars, training opportunities, our implementation plans after the legislative session. And it's always a good idea to make that reviser of statute website a favorite on your computer, and that link should be in your handout. And when you want to know about a rule or a statute, finding it directly through that website and being able to read that text yourself is the best way to do it. And finally, just a reminder about reporting requirements and where to report. So people who work in programs licensed by the department are legally required or mandated to report suspected abuse, neglect, and exploitation of children, but anyone can voluntarily report. If you suspect abuse or you need to report licensing violations, it's always better to err on the side of caution and make a report, because reports can go 3 different ways. If it's determined that the report does not allege abuse or neglect or licensing violations, the report could be screened out. If the report does allege abuse or neglect of a child at a licensed child care center, it may be assigned to a DCYF maltreatment investigator who might come out to do an on-site investigation. And if the report alleges licensing violations, it might be assigned to your DCYF licensor, who might come out to do an on-site investigation. And if you need to report a serious injury or a death in the program, you can use the fillable PDF form from our website to report. And a reminder that a serious injury is an injury received while at the program that was treated by a doctor, including a dentist. Your licensor is available by phone or by email for any questions that you may have. And DCYF licensing also has a licensor on call Monday to Friday from 8 to 4:30. And that is what we have prepared for today's webinars. Should you have questions about your specific program or situation, always know that you can reach out to your licensor and they will do their best to answer your questions or guide you to one of our partners if that's applicable. We hope we were able to provide you with some valuable information and resources. I will drop the link to the handout again one more time in the chat. And we hope that you have an amazing afternoon. And thanks again for all you do for children and families in Minnesota.